My name is Dr. Bhatti. I'm a breast and general surgeon, and I've been in practice for 15 years in the Chicagoland area. I went to medical school in the Aga Khan University, Karachi, Pakistan. This was a university started by doctors from United States who went back to Pakistan and wanted to start a medical school. I did my research fellowship in St. Mary's Hospital in London, UK, and then I did my residency in general surgery at the University of Illinois Metropolitan Group Hospitals program in Chicago. I trained as a general surgeon, which means I do bread and butter general surgery. I take out appendices, I take out gallbladders, fix hernias, take out colon cancers. But also I have become involved in breast surgery now, and that has become sort of my passion. And breast surgery involves both benign and malignant breast diseases. I am certified by the American Society of Breast Surgeons to perform breast ultrasound. I believe a breast ultrasound is a very important tool available to a breast surgeon to determine if a patient has a benign condition like a cyst that can be taken care of in the office, or it's a malignant tumor which may need to be biopsied. Also in my office, I do another procedure which is called accelerated partial breast radiation. And that's done for 5 days, 10 sessions, and in 5 days, patient's treatment is completed. And this is in comparison to whole breast radiation, where you have to radiate a patient every day, 5 days a week for 6 to 8 weeks. So this is obviously a much more efficient way of delivering radiation, and patients love it, and the cosmetic results are much better too. So that's another test that I do, or procedure that I do in my office. I also offer genetic testing for breast cancer in the office, which is just a test where we take a buccal swab and test the patient to see if they have the genetic mutation for breast cancer. My policy is that any patient who undergoes a breast mastectomy will be given the options to have breast reconstruction, because I believe that that will eventually affect the patient's self-esteem and her body image. Now, the patient may say, I don't want reconstruction, and that's absolutely fine, but patients should be given this option. I want to be a patient's partner. I like to be their advocate, and I want them to feel that they can talk to me at any time. We spend a lot of time talking to patients, which is somewhat difficult nowadays in the current climate of healthcare, but I will do whatever is needed to make my patients comfortable with me in the office. Being a female, being a mother, I think I understand the problems my patients have to face when they're facing a diagnosis of cancer while juggling their life and their career and the family. And so this has given me, a different perspective on these patients, I think. And being somebody who likes to talk to patients, my patients feel very comfortable with me. I get this compliment all the time. Patients will say, I feel like I've known you all my life, and I've just talked to them for 5 minutes. So I just feel that I think this is my calling. I had to become a surgeon, had to become a breast surgeon, and that's why patients like me. My work is extremely rewarding. I've felt this all along, and now even more as I'm getting older, unfortunately, and my patients are getting older. We are able to connect as friends over this period of time. Patients who I give the bad news that you have breast cancer, your 5-year survival is, say, 80% if it's stage 2 breast cancer. They'll see me 5 years later and they'll say, Doc, I'm still around. And just seeing the look on their faces and the fact that they're enjoying life and they're able to see their children graduate and their grandchildren graduate, and just seeing them being around is very gratifying for me.